Hello everyone, I hope you all are doing good. Let's take a PYQ topic. What is the management of the cancer cervix stage 1B in a 50 years old female? So for this management of cancer cervix is a very important topic. Let's study in detail. The management of cancer cervix depends on the stage of the cancer cervix. So how we do a staging of a malignancy? So stage 1 of any cancer is a stage if the cancer is limited to the very organ of which it is. For example, if it is blood cancer, it is limited to blood, it is stage 1. If it is cancer cervix, if it is limited to cervix, it will be stage 1. If it is limited to the very organ of which it is. Okay. Stage 2 and 3 means now that the cancer has started metastasizing to the other organs. Okay. Now it depends where the cancer will spread. It depends on the mode of the spread of the cancer. Okay. It can be hematogenous spread, it can be lymphatic spread, it can be direct spread. Direct spread means organ to organ. So every cancer has its own mode of spread. So depending on the mode of spread, it will be stage 2 and 3. And stage 4 means the organ after spreading to that organ, the cancer has the worst prognosis. Okay, it means that once the patient has landed up in the stage 4, the patient will soon expire. Okay, so stage 4 means metastasis to the organ, mostly it is lung and liver, and after metastasizing to that organ, there is extremely poor prognosis or death is nearby. Okay, now let's see how we stage the CS cervix. Okay, how we stage the CS cervix. In the CS cervix, stage 1 means that the cancer is limited to cervix itself. Okay, stage 1 means because it is CS cervix, so cancer will be limited to cervix itself. Okay, stage 2 and 3 means now the CS cervix has spread beyond the cervix. Okay, so now because the mode of the spread of the cancer cervix is direct spread. Direct spread means organ to organ. So organ to organ. So stage 2 and 3 means that the cancer cervix has spread to the nearby organs. What are the nearby organs in the nearby organs to cervix? Vagina, parametrium. What we mean by parametrium? Parametrium means all the tissue which are near the uterus. Metrium is the word which we use for uterus. So all the tissues which are near the uterus, and at the most periphery it has spread to the pelvic wall. So if the cancer cervix has spread to vagina, parametrium and pelvic wall, it will be stage 2 and 3. Stage 4 is liver and the lung metastasis, where it has a poor prognosis. Okay, is it clear everybody? So now the stage 1A, it is stage 1. Stage 1 is divided into stage 1A and stage 1B. Stage 1A means that cervix growth was not visible to the eye. So the cervix growth which is not visible to our naked eyes is one which are less than 0.5 centimeter or 5 mm. Okay, so stage 1A means that the cervix growth was not visible to the naked eye. It was confirmed on the biopsy. So now it was less than 0.5 centimeter or 5 mm. So we put in 1A. Stage 1A is further divided into 1A1 and 1A2. Stage 1B means that the cancer growth is more than 0.5 centimeter or 5 mm. That the cancer growth is more than 0.5 centimeter or 5 mm. It is 1B, and 1B is divided further into 1B1, 1B2 and 1B3. So you have to keep in the mind that 1A is divided into 2 stages and 1B is divided into 3 stages. Now similarly, let's see how we treat cancer. Basically in the cancers, we want that the organ should not keep on proliferating, then only the cancer will heal. So if the cancer is at the earlier stages or at the stage 1 or stage 1 earlier stages, it is possible that if we remove that tumor, the cancer will be treated. Okay, so it is if the cancer is in the earlier stages, then the surgery is the treatment. Even the surgery is the most preferred treatment in the cancer, because all the rest other treatments, they have the side effect to the whole body. Let's see what are the other treatment. Radiotherapy. What do you understand by radiotherapy? That we will be giving radiations to the tumor, to the malignancy, so that it stops proliferating. Now this radiations will affect the other organs, nearby organs also. Okay, so this is a less preferred treatment than the surgery, but it is done when surgery cannot heal the cannot treat the cancer. Okay, so it is done when the tissue is radiosensitive and when the surgery cannot be done. Okay, so tissue has to be radiosensitive to give radiotherapy as a treatment, and then when the surgery cannot be done. Chemotherapy is done to the tissues who are sensitive to the cytotoxic drugs. Cytotoxic drugs are those drugs which stops the cell division, like methotrexate, cisplatin. Okay, so if the tissue is chemosensitive and the surgery cannot be done, then we give the cytotoxic drug. Okay, concurrent chemoradiation. What we understand by this term concurrent chemoradiations? It means that the tissue was radiosensitive. That the tissue was radiosensitive, but if we give chemotherapy, if we give a drug into the patient body before the radiotherapy, then the radiosensitivity of the tissue will increase. Are you understanding this term? What I mean by the concurrent chemoradiations means chemo and radiations are both given together. Chemo and radiations are both given together. Why we are giving both of them together? It is not that the tissue can be treated by chemotherapy. We are giving the concurrent chemoradiations means we are giving the chemo and radiations together because the tissue was radiosensitive. By giving the chemotherapy before the radiations, the radiosensitivity of the tissue get increased and the patient gets healed early. Okay, so but you have to remember that alone chemotherapy is not going to work, and if the choice chemoradiation is not there in the option, then you can choose radiotherapy, but you cannot choose chemotherapy at any cost. Okay, so now let us study what is the treatment of CA cervix. CA cervix can be treated by surgery up till the stage 1B2. So stage 1B3 cannot be treated by surgery. So CA cervix can be treated by surgery up till stage 1B2. So it is easy to remember. B is the second alphabet and 2 is the second number. Okay, so up till 1B2. So it is but obvious that we can treat the cancer by surgery up till only stage 1. But in up till stage 1, which stage? Substaging, it is B2. Okay, in CA cervix beyond 1B2, what is the treatment we give is concurrent chemo radiation. If the staging is beyond 1B2, it is 1B3, 2, 3, 4, we have only one treatment, that is concurrent chemo radiation. Okay, now which is the chemical, which is the cytotoxic drug or chemical we will give before the radiation? It is cisplatin, and this is one of your recent PYQ. Okay, so now let's see what all are the surgeries we do in the CA cervix. If it is 1A1, if the cancer is 1A1, I told you we divide 1A into 1A1 and 1A2. So if it is 1A1, then we do the simple hysterectomy or total abdominal hysterectomy. It is also known as type 1. So type 1 is total abdominal hysterectomy. If it is 1A2, now we do the type 2 hysterectomy, which is modified radical or Verdein's hysterectomy. Now if the cancer has come to the stage B, 1B, now it means now the growth is more than 0.5 centimeter or 5 mm. Now once the growth is visible to the naked eye and it is less than 1B3, then we have to do the radical hysterectomy or the type 3 hysterectomy. Okay, is it clear? So once the cancer is visible to the naked eye, it is in stage 1B. Whether it is 1B1 or 1B2, we have to do the type 3 hysterectomy. Okay, so you can see B is opposite to 3. So once it is in the B stage, we have to do the type 3, and beyond 1B2, that is in the 1B3, we will always give the chemo radiations. Okay, now let's see the question. In our question, the patient was in the stage 1B. Okay, the patient was in the stage 1B. So our treatment will be B is, I already told you B, we write the 3 already in the B. So answer is type 3 hysterectomy. Type 1 hysterectomy was done in 1A1 and type 2 was done in 1A2 and beyond 1B2, beyond 1B2 we were doing the concurrent chemo radiations. Okay, now let's see now let's take a question from the NEET PG 23. A 50 years old woman presents with a foul smelling bloody discharge mixed with mucus. On examination there was a necrotizing growth can be seen in the cervix. So growth on the cervix it means the CS cervix with lateral parametrium involvement. So here it is involving the lateral parametrium. So what is it? What is the stage? It is stage 2 or 3. Right. And what is the management for this patient? Once the lateral parametrium is involved, the management will be chemo radiation, because beyond 1B2 the treatment was chemo radiations. Okay, so you will not mark here radiotherapy alone or brachytherapy. Okay, because the tissue sensitivity increases by giving the chemical radiation. The tissue radiosensitivity increases by giving the cisplatin drug. So the best answer will be chemo radiations, and surgery can be done only up till 1B2. Okay, thank you. If you find this information valuable, do like, share and give a honest feedback in the comment section. Keep subscribing my channel for such more videos. Thank you.